Hello, I'm Alfie Carlisle. Welcome to The Pulse from Heart, which brings together eminent doctors, psychologists, scientists, and academics to discuss the rapidly changing landscape that is the coronavirus response. The topic of vaccine passports has been on the lips of many, termed COVID status certificates by the Prime Minister Boris Johnson. They are, broadly speaking, a way of proving verifiably that one has been vaccinated against COVID-19. In response to this, over 280,000 people have signed an online petition asking the government to drop any such plans to roll out any form of vaccination passports, citing the fact that such a system could be used to discriminate against those who have not yet been jabbed. This has triggered a parliamentary debate tabled for the 15th of March. To discuss this move and its impact upon citizens in the UK, I'm joined by Alan Mordue, a retired consultant in public health medicine, Liz Evans, a retired doctor and founder of the UK Medical Freedom Alliance, and David Seedhouse, who is a professor of deliberative practice at Aston University. Thank you all for joining me this evening. To come to you first, Alan, so from a perspective of public health, isn't this a way that we can get out of lockdown by going to this passport system?
No, I don't think it's required really. We already have very high vaccine uptake levels, so I don't think we need to coerce people to get those any higher. And coercion and mandatory vaccination is something we've never done in the UK before, and I don't think it's something we should do in the future. The only justification I can think of coercing people, of making vaccination mandatory, would be if we face a very severe threat to the population health. And I'm thinking here of mortality rates of 5, 10, 15%. So COVID-19 is certainly serious in some people, unfortunately, and does kill some people, unfortunately. But the infection fatality rate has been estimated to be about 0.1 to 0.2%. So this is not a smallpox, and it's not an Ebola fever. So I think we don't need to resort to mandatory vaccination. So I think that sort of response would be disproportionate, and it just isn't needed.
David Seedhouse, just to come to you briefly, Alan there, we're talking about coercion. So, I mean, is this something that is particularly ethical in a society like ours?
Well, what people mean by ethics, changes, and there's no one absolute definition of ethics. I mean, you have to be straight about that. But this all hinges on the difference between the way public health doctors perceive what they do and the way every other doctor perceives what they do. And there is a 100-year tradition of building up informed consent, person-centered care, legally and ethically. If a doctor deals with an individual and doesn't get permission to touch them, then it's effectively a battery or on assault and battery. So that is very, very fundamental. What we don't have in public health, and Alan may want to expand on this or correct me if I'm wrong, is that same duty of care, because public health doctors, and it's not just medics, but mostly public health doctors, do not see individual patients, and that changes the whole tone of what happens. They're looking at charts, they're looking at populations, they're looking at people in general, and they're not thinking, well, we should involve these people, we should ask them, but we need to get this R rate down, or we need to stop this disease. It's imperative, and that tends to dominate their perspective. And what that means is that if you're working with an individual, then coercing them, bribing them, threatening them, whatever, telling them lies is considered by pretty much everybody in ethics totally unethical. In the public health sphere, we don't have that same level of agreement. And so that is the fundamental problem. When you talk about ethics, that we're talking about actually different things in different professions.
Dr. Liz Evans, I mean, David, they're talking about informed medical consent. What's your take on this idea that without a passport, people are probably going to have quite a difficult day-to-day life? They won't be able to do what we would consider quite normal things. I mean, how does this impact a patient's medical consent?
Well, obviously, I've come from the UK Medical Freedom Alliance, and this is a massive issue that we're campaigning on, because we are looking at issues that will impact on our basic human right to bodily autonomy. which is the freedom to accept or decline a medical treatment or intervention without any penalty or restrictions being applied to you. And that needs to be free, and it needs to be without any coercion or pressure being applied. Now, these rights at the moment are enshrined into UK and international law. There's many international declarations, such as the Nuremberg Code, which was drawn up after the Second World War and the Holocaust. You've got the Universal Declaration on Bioethics and Human Rights, and you've also got a very, very recent Council of Europe declaration from the 27th of January, which has been really, really clear about these particular vaccines, and I can actually read it. So they are a European Court of Human Rights, effectively, which is not binding in law, but it's sort of a very, very internationally respected court that we are signed up to. And they have said that we need to ensure that citizens are informed that the vaccination is not mandatory and that no one is politically, socially, or otherwise pressured to get themselves vaccinated, and also to ensure that no one is discriminated against for not having been vaccinated. So I think in a Western, free, liberal, democratic society, these rights are, fundamental in the way that we treat our citizens. And I think vaccine passports would really threaten these basic freedoms and effectively would indirectly mandate these vaccines and would be a coercion to accept the vaccines, because people would lose access to services and just the basic sort of normal life, travel, hospitality, leisure, public transport, all these things that we just take for granted in a free and liberal society. Not only is it unlawful, but it is unethical to be coercing individuals through restricting freedoms to accept any intervention medically. But actually, there's something particular about these COVID-19 vaccines. They're still experimental. The trials do not end until 2023. We have limited short-term safety data, but we have no long-term safety data at all, because they just haven't been in people's bodies for long enough. I mean, that's where Nuremberg was particularly focused on, that no human being should ever be forced to be in an experimental trial ever again. That would be a very, very big reason not to go down this route. Inevitably, what would happen is you would get discrimination occurring to those who were unwilling or unable to have a COVID vaccine, and you'd completely undermine the right to choose for your own health. And you would end up with a two-tier society, which people have called a medical apartheid, because people would end up restricted in their access to very, very basic services, which would be really unfair.
Or isn't it true, rather, that if unvaccinated people can cause transmission asymptomatically, that we need this measure to protect everybody else?
I'd quite like to challenge that idea of asymptomatic spread, because actually, although it's been a widely accepted truth and was a hypothesis put out very early on in the pandemic by China, and it's become the orthodoxy, actually, if you dig deep into the science, you find that it just isn't supported by the data that we have. And the meta-analyses that have been put out to support the theory of asymptomatic spread are actually based on 6 cases of asymptomatic people possibly infecting 7 people in the whole world. And then the Journal of the American Medical Association just put out a survey of household contact spread of 80,000 people. With symptomatic people, you can expect to get about 18% chance of passing it on to your close household contacts. But for asymptomatic or pre-symptomatic people, the risk was only 0.7%. And it's likely that most of those 0.7% risk are going to be the pre-symptomatic people, i.e. the people who are going to become unwell. So I think the risk of somebody who is healthy, who has no symptoms, it's going to be a very rare and extremely negligible risk. So it doesn't justify the downsides of vaccine passports when you can't really say that that's going to make a big difference.
It's also the case that the evidence for the vaccination stopping transmission isn't certain. It's not an area that we have good data on, good evidence on. So people assuming that if they're surrounded by people who have been vaccinated, there's no chance of them picking up the virus. We can't say that yet. So I think this is a false premise, and I think it underlies the whole vaccine passport thing. So yeah, I think it's a big hole in the argument for a vaccine passport.
It sounds like we have a situation where we have a virus which really doesn't kill a lot of people. In broadly speaking, we have a vaccine which we're not sure of the efficacy of, and now we have this situation where asymptomatic transmission possibly is not as big of a problem as we thought it is. So I suppose my question, based on all that, to you, Alan, as a public health consultant, I mean, is this even necessary? Does this make sense to be spending public time and money on?
I think it's enormously helpful to, when we're thinking of coming out of lockdown, that we have those high-risk groups. They've almost all now been vaccinated. So I'm thinking here of the 9 priority groups that the JCVI recommended. So very shortly we'll have covered all of those. Once we have, I think there's no reason why we shouldn't come out of lockdown. And I certainly don't agree that we should be vaccinating people below 50 unless they have serious underlying medical conditions. And if they do have, they will then be in one of the 9 groups. So people below 50 without serious conditions, I don't think should get a vaccine. And that's partly because they're at very low risk, far lower than the average for the population. I quoted a 0.2%, and also because we don't have long-term safety data. So until we get that in 2023, we can't be certain that young people are going to have a net health benefit.
I think from an ethics point of view, there is a major difference dependent on what the vaccine is capable of doing. If it protects the individual only, that's one thing. If it prevents transmission to other individuals, that's completely different. I wouldn't coerce or make anything mandatory. I'd much prefer an education and informed consent of participating citizens in a democratic environment. But it does make a difference. I mean, if it's just down to you and it's just yourself you're protecting, then there's absolutely no need for a vaccine passport. There's just no need to coerce anybody. It's down to the individual. There is, there would be a bigger discussion to be had if it absolutely was guaranteed to stop transmission. But as Alan said, and as I understand, we don't know that yet.
How would we therefore go about balancing up these individual needs with the wider community needs? Because clearly this is something which affects, well, quite literally the whole population.
Well, this has been the fundamental problem throughout this whole affair. Normally, individual rights trump other interventions, even if the person who's intervening thinks the person needs it and is in their best interest. I mean, a medical intervention, even if it seems obviously in another person's best interest, is not permissible without their consent and their permission. It's very straightforward. The normal state of affairs is that rights and individualism matters more than anything else, in this particular society, and of course in other Western democracies. That changed overnight, and now the idea is that public health or community needs trump human rights, basically, unless you just have one human right, which is the right to life. And it's just too simplistic, it's too naive, and it's all these other things that people have been saying for a year. It's authoritarian, draconian, and it's not democratic. So ultimately, there's a difference between the individual consenting and a population consenting. You can't have a population consenting, but what you can do is involve people in citizens' assemblies, in democratic exercises. And there's many, many examples around the world. And if there's a due process, if there's a sense in which we can have a say, it will be listened to, it will make a difference, and it's not just down to a handful of people to make these massive decisions, that would be a very positive move forward that would, to answer your question, begin to balance up the difference between the individual rights and supporting a community when there's a sickness abroad.
We've had the most unprecedented, difficult, damaging year with hugely draconian restrictions on our individual lives and freedoms and civil liberties. And it feels at this point, pandemics don't last for years and years normally. They come, they go without actually any human intervention in history. We've never tried anything like this before. So there's no reason to think that this pandemic is going to last for years and years and years. We must be approaching some sort of herd immunity through pre-existing immunity. So some people will never get it because they've got cross-reactive T cells. Acquired natural immunity, which is looking like it's going to be long-lasting. So the people who've already had it. And then you've got the most vulnerable have been kind of doubly covered by being offered the vaccine. So even if they've had it, they've also got the vaccine. So we've kind of covered them as well. And at this stage, if we brought in vaccine passports, we are going to be increasing the restrictions on our freedom and human rights permanently, because you don't bring in a system like that for a few months. That's a permanent change to your way of life, and we are going to permanently restrict our freedoms, our autonomy and our privacy, and increase the state power in our lives. And I think we're at a really dangerous point now, because we have a choice. Do we go down that route and say this is how we want the foreseeable future to be, or do we have the courage now to actually relax control, trust in, the vaccines and our immune systems and the natural progression of viruses, which we know from history don't last forever, the respiratory viruses, and actually allow a return to normal life and freedom and get people to start taking individual responsibility for their health. We have so many vaccines. If people are really scared, they've always got the option to have one, even if they're young and they're scared. But there's no need to be giving it to everybody. It just seems to be such an unnecessary and disproportionate move in the wrong direction.
So, David, to come back to you, the passport system is being heralded as a way for people to be able to travel abroad. The government's saying lots of other countries are implementing it, so we have to as well. What do you make of that?
Well, we don't have to do anything. We really don't, and it's unnecessary. On either of the scenarios, if it's just down to the individual and it just protects the individual, then that has to be an individual choice. It's quite fundamental. It's not really anybody else's business. If it reduces transmission, and again, really, that's up to the individual to be generous and to think of the community and think of other people. Think, look, I can have this and I will protect other people. You don't need to bully people and coerce people to make them generous and kind.
It's almost becoming obsessive now that there's this sense of we won't rest until we've eliminated every single case of this illness, however mild it is. And I just don't think that's rational. And actually what we need to be doing now, the messaging needs to be to reduce fear and reduce control. So to tell people now, you're safe, you're fine, let's just go out and you don't need to worry about your granny anymore. She's had the vaccine, she's safe. A much more positive message, and to tell people that natural immunity is being shown to be longer lasting. So if people have had it, they don't need to be paranoid that they're going to catch it again and end up in hospital. That's highly unlikely with a respiratory illness. If you've had it mildly once, if you did get it again, you're not likely to get it worse. So just releasing people from restrictions, because I think it's taking responsibility away from people. We've got to start giving them responsibility back so that they can take control of their own lives and take control of their own risk assessments, and trusting people who are more vulnerable just will be more careful. We don't have to legislate to make them be like that. So a more positive and empowering message I would give.
I think that's part of the problem is that we're being talked at, we've been pushed around, we've been told what to do as if we are infants. I mean 2-year-olds, basically. We've been treated so badly. So the idea that, we will respond to this message, that message, even though they're deeply confusing and they change every 2 weeks, is just wrong. It's just wrong. We've grown ups, we're adults, we've been through an education system that ought to be sufficient to give us the wherewithal to think for ourselves. The messaging has to stop, full stop. But we're all intelligent people. We need to be respected properly by government. Our government, they work for us, and this has to stop.
I think the overall message needs to be one of reassurance, and it's going to take quite a while to reverse the year-long information we've had, which seems to have been intent on trying to generate fear and alarm in the population. We need to do the reverse now. We need to reassure people, and we need to try to give accurate information. we need to compare it with flu, which I think is the nearest comparator to COVID-19. And I think vaccine passports would do the reverse. It would just continue with the fear. And so too, I think, will continuation with the face masks. I think it would be enormously helpful as we come into the summer. If we could eliminate the face masks, that would help to allay fear.
Yeah, because I think it's a fallacy to believe that you add a restriction to give people confidence, because it doesn't do that. I think it actually it stokes the fear. You know, like putting masks into schools, that's led to more fear. The only way people can build their confidence again is by getting rid of these restrictions, make them voluntary. What would be really good is to follow the example of Florida and Texas and the other states in America where all mandates have been removed. So things like masks, social distancing are voluntary. And what happens then is you start to reduce the fear in the population. And I think as the confidence grows in the population, the most fearful start to trust themselves again and start to embrace life again.
There's this argument that people traveling to certain countries have to display at the border proof that they've been inoculated against yellow fever. Is that not the same thing?
No, I would say that's not really a good comparison. I mean, I've heard people make that argument, but actually it's a completely different situation. Yellow fever is an incredibly deadly disease. I think the mortality is up in the tens of percent, not sort of 0.1%. It's very limited areas of the world. And also it's a vaccine that has lifelong immunity. So you have your dose and that's it. This is very different to what we're hearing about these COVID vaccines, where they're even talking about, a group from Oxford was saying you would probably have to show you'd had a vaccine within a very few months of your travel. So we're looking at booster shots every year, possibly twice a year. We don't know how long the vaccine immunity lasts because, again, we're still in the trials and there is no data really beyond about 2 or 3 months on the duration of immunity. So it's a completely different situation. And obviously, we'd be asked to do it for every place we went to, not just if we chose to go to some very specific areas which had a high risk of yellow fever.
Following up from what Liz said there, the sort of logistics of all of that and the effort involved is so disproportionate to the sort of threat from this illness. Once we vaccinated the high risk groups, the rest of the population don't need to go through all of this. They are at very, very low risk. It's a flu-like illness. It's totally unnecessary. And the NHS resources that will be devoted to producing the vaccine, delivering the vaccine, will draw staff away from treating other patients.
And something which has worried us is that this would be opening a door to basically having to take anything the government decided you needed to have injected into you to be able to live your life. So this would not end with COVID, I'm sure. There would be a temptation to then say, well, yeah, you need your flu one on your vaccine passport. Oh, maybe the MMR, maybe, whatever new vaccines are developed. And actually, this seems like a great business opportunity for the pharmaceutical industry, but not great for our health or resources. And it's just going to be a slippery slope. And I think it's a door we just don't want to open.
There's one other area that perhaps we haven't covered, certainly not to any depth, and that's the sort of discrimination against the unvaccinated individuals and the effect that would have on, I suppose, social cohesion and on the health and well-being of those people, those groups. And some employers have already been talking about no jab, no job. So this will affect not just whether people can go on holiday to Spain once a year, but it will have major implications. They'll be excluded potentially from restaurants, cafes, pubs, and jobs.
That's another fundamental ethical principle that most people in the West do agree on is that people should be treated equally. And so deliberately creating barriers and distances between people this is a really important sort of place to say that's enough.
So I think when it comes to medicine, this could become a real abuse of science and medicine because it is a tool to help us, not to control us. and everybody is different. And I think everybody knows their own susceptibilities and weaknesses and strengths, and therefore has to be allowed to make their own decisions about their health and what will help them and what risks they're prepared to take. And that has to be an individual choice. It cannot be up to governments to make that choice for us as individuals, because that dehumanizes us, and it's just not appropriate. It's illiberal and it's undemocratic, and it's a really dark path we don't want to go down in this lovely country.